No more endometrial cancer. The uterus is a pear-shaped organ located between a woman's hip bone's pelvis. When a woman is pregnant, the baby develops in the uterus. Uterine cancer is cancer that starts in the body of the uterus rather than the cervix. Cervical cancer is a different type of cancer. The most common type of uterine cancer is endometrial cancer. Most uterine cancers start in the lining of the uterus, so it's also called endometrial cancer. About 75–80% of endometrial cancers are adenocarcinomas, which develop from glandular cells. Sarcomas are another type of cancer that develop in muscle or connective tissue. Sarcomas are more aggressive than other types of tumors. Less than 5% are uterine sarcomas. Endometrial cancer is the most common gynecological cancer and the fourth most common cancer in women in the United States. The cancer often develops in women after menopause, especially between the ages of 45 and 74. What are the risk factors for uterine cancer? The following risk factors may increase your risk of uterine cancer. Women aged 40 to 74 years, obesity, taking estrogen without progestin for hormone replacement, women who have never had children, irregular ovulation and frequent missed periods, diabetes, polycystic ovary syndrome PCOS, endometrial hyperplasia, abnormal thickening of the uterine lining, family history of endometrial cancer, tamoxifen treatment. What are the symptoms of uterine cancer? The most common symptom of uterine cancer is abnormal vaginal bleeding. This includes menstrual bleeding that is heavier than usual, bleeding between menstrual periods when a woman does not have a period, bleeding after menopause, vaginal discharge that ranges from pink and watery to dark and foul-smelling. About 9 out of 10 uterine cancers are discovered because of postmenopausal or abnormal vaginal bleeding. Therefore, uterine cancer is often diagnosed early. If you experience abnormal bleeding, especially if you have gone through menopause, you should talk to your doctor right away. These symptoms can also be caused by conditions other than cancer. However, if you experience any of the symptoms listed above, talk to your doctor. Endometrial cancer is divided into several types. Type 1 cancer is more common, responds to estrogen, and is not very aggressive. It tends to occur in younger women or obese women, or in women who are going through perimenopause the years before and year after their last menstrual period. Women with type 1 cancer have a good prognosis. Type 2 cancer is more aggressive and tends to occur in older women. About 10% of endometrial cancers are type 2. Women with type 2 cancer have a poor prognosis.